This is Miriam Tucker reporting from the annual meeting of the American Association of Clinical Endocrinologists. I'm here with Dr. Scott Lee of Medtronic, who's presenting the 2-year data on the Resolute Drug-Eluting Stent in patients with diabetes. Dr. Lee, can you tell us a little bit about what you found?
Yeah, thanks, Miriam. Very exciting about the results. There was a predefined endpoint, primary outcome, looking at cardiovascular events, heart disease, restenosis, heart attack, and the Resolute trial had a very strong meeting of that performance goal that was strongly statistically significant.
This is the first stent approved specifically for patients with diabetes. What's the significance of that? Why do they need a particular type of stent?
Right. Well, what's interesting about this particular pooled analysis is that coronary artery disease is on the top of many providers' mind, whether it's the cardiologist or whether it's the endocrinologist or healthcare provider taking care of someone with diabetes. And the options for stent have previously been limited. So patients with diabetes have pretty severe heart disease, and so often they need to undergo bypass surgery. So having a drug-eluting stent, which then is indicated for patients with diabetes, really helps our diabetes patients to have more therapeutic options that are available in a real critical period of time when they're having acute coronary artery syndrome or they have a significant blockage for their heart disease.
You mentioned there was a difference between the diabetics who were treated with insulin and those who weren't. Can you just go into that a little bit?
Yeah, so really great finding was that the non-insulin dependent patients had very similar cardiovascular outcomes as the non-diabetic patients. So that was very important because often when you think of diabetes, you think of an increased risk for mortality and morbidity after a coronary artery event. So that was a nice surprising finding or trend, because this was not statistically powered, a trend where the non-insulin dependent diabetic was very similar to the non-diabetic. The insulin requiring was slightly higher, and that's something you would expect. But overall, that incidence for cardiovascular events was way lower, or much lower, than the predefined endpoint for that primary outcome that the study was looking at.
This is Miriam Tucker reporting from Philadelphia.